Thank you so much, and thank you everybody for tuning in, especially those people in Israel. It must be 11:30 or some amazing time, so thank you. I'd like to talk for the next 40 minutes or so about the impact of COVID-19 on human trafficking here in the United States and really globally. I think a lot of this is applicable globally. I'm hoping that at the end you'll be familiar with the risk factors for human trafficking and understand how those risk factors may be exacerbated by the COVID-19 mitigation efforts, how the two essentially public health crises are coming together and exacerbating each. And then we'll talk about some strategies that professionals can use to mitigate the risk of labor and sex trafficking and protect children. Just a word about words. Throughout this talk, I'll be using the term trafficked person as much as I can, but occasionally I use the word victim. And I want to make sure that I emphasize that when I do use that word, I'm using it entirely the legal sense, referring to a person who has had harm done to them by somebody else. There's no subjective interpretation of it. It's simply a legal definition, and it's used for clarity. So just to give a quick, brief overview of human trafficking to get us going, the U.S. federal definition of human trafficking is based, like most countries, on the United Nations Palermo Protocol. It's almost exactly the same, not quite. But as with the Palermo Protocol, in order to show that human trafficking has occurred, you need to show an action, a means, and a purpose. And the action can be one of the items in the left-hand column. It's like an a la carte menu. You don't have to show all of these actions have taken place, but you need to show at least one. And you need to show that there was force or fraud or coercion used. And coercion can be subtle or it can be very blatant. Blatant like as in threats, or subtle as in taking somebody's passport and their visa so that they cannot leave. And the means is for the purpose of exploitation. And for all intents and purposes in the United States, there are two types of trafficking: exploitation, commercial sexual exploitation, and forced labor. So an important caveat in the United States and elsewhere is that when you're dealing with child sexual exploitation, and a child is anyone under 18, you do not have to show force or fraud or coercion, because legally, it's felt that legally the child is not capable of providing an informed consent to be exploited. Now, they may, at a certain age, depending on your state, be able to consent to have sex at 16 or so, but they cannot consent to be sexually exploited commercially until they're 18. So the means becomes irrelevant when you're talking about child sex trafficking. When people ask me all the time about the numbers of trafficking cases in the United States or globally, the question is always, how big a problem is this? And the answer is probably always going to be, we're not exactly sure. We don't have reliable estimates of prevalence and incidence because this is an illegal enterprise, and so it flies under the radar screen. Very few cases are reported. It's under-recognized and misinterpreted by some people, so people won't recognize trafficking for what it is. For many reasons, trafficked persons don't spontaneously disclose their trafficking situation usually. Global databases are decentralized, as are national ones. So for all of these reasons, we don't have good numbers. And whenever you see numbers thrown out there, 30, 300, 300,000, 3 million, 30 billion, whatever it is, keep in mind that these are all estimates. So we have to, and they are based on a lot of assumptions. So it's important to keep that in mind. When we think of trafficking, we tend to think in stereotypes. Now, perhaps the people on this webinar are much more familiar with trafficking, so you don't think in stereotypes, but I think in general the public does. And when you say to somebody, what is sex trafficking, they tend to think of the victims of sex trafficking as being girls or women, and the traffickers as being men. So it's a very gender-based thing. They tend to think of it as involving prostitution. It's paid sex, that's what it is. And a lot of people think that this is something that happens in different countries. It's foreign victims. It doesn't happen in this country, or when it does, they bring foreign people in to the United States to be trafficked here. And that certainly is true for a certain number of cases. Many cases do involve girls and women and men as traffickers, et cetera, but there's more to it. And when we think of labor trafficking, we tend to stereotype that this involves foreign victims. They're brought in from another country into whatever our native country is. It's usually boys and men, and they're put out to work in migrant farm workers. That's sort of the typical thought of labor trafficking. But really, we have to look much beyond that to a bigger picture of what sex trafficking and labor trafficking entail. For sex trafficking, we know from a lot of studies, many studies of runaway homeless youth in many countries, the United States, Israel, several European countries, Canada, that many of the runaway homeless youth that are engaged in what we call survival sex, or exchanging sex for things that they need, are boys and transgender youth. So this is by no means something that is confined to females. In the United States, of the identified sex trafficking victims, the majority are American citizens or legal residents. And so we certainly have a lot of international trafficking, people coming into the United States to be trafficked here from other countries. That certainly happens, but they are more the minority than the majority of the identified victims. And we have to remember that females can traffic as well as males, and we have to get out of that mode of thinking that this woman who may be accompanying this child is completely safe, that she couldn't be a trafficker. She absolutely could be. And minors can also be recruiters as well. So trafficking can be between peers. When we think of labor trafficking, we have to think that girls and women are very often labor trafficked, especially in hospitality industry types of things and in domestic work. And really, the occupational sectors involved in labor trafficking are only limited by the sectors that are prominent in any one country. Within the United States, construction is big as a labor trafficking industry, hospitality, service work, domestic work. Forced criminality is very big in the homeless street-based youth. They are forced to sell drugs or move drugs or engage in petty theft, for example. When we look at risk factors for human trafficking, I think it really helps to look at the risk factors using a socio-ecological model and realizing that risk factors can occur at many levels. There can be individual risk factors that are unique to a particular individual, and we know that a history of child maltreatment, especially sexual abuse, is a big risk factor for sex trafficking, and homeless runaway status is a risk factor. LGBTQ status, lesbian, gay, bisexual, transgender, queer, questioning youth, and young adults are at high risk of sex trafficking and certain types of labor trafficking as well. So individual risk factors are prominent, but there are also a lot of factors at the relationship level, family violence, family poverty, any type of family dysfunction. Families that are forced to migrate, all of those interpersonal factors can play into increasing the risk of trafficking. And then there can be community risk factors where the whole community is at risk because of certain factors like high crime rate or a tolerance for exploitation, or in some very rural communities where everybody is migrating to get work. And so that's sort of the norm. So everybody's at risk. And then at the societal level, a lot of gender-based violence and discrimination around the world, cultural practices, cultural beliefs can all play into facilitating trafficking. So let's look at some examples. We're going to follow these kids through the rest of the talk. Hector is a 17-year-old male from a very small rural village near Villanueva in Guatemala. His parents worry about gang violence, which is very prominent in Guatemala, as you probably know. But they're extremely worried about Hector because he's a boy and he has mild cognitive delays, so he's even more vulnerable. His mother works with an employment recruiter there in Guatemala, and the recruiter says to her, "We can get your son a job in a restaurant in Houston. And we'll get him into the United States, we'll get him a passport and a visa, we'll get him a job and an apartment, he'll be fine, and he can send money back. And this will cost you $5,000 US, but Hector can make it up in the first 2 weeks and send it back to you." So that's Hector. Pat is a 14-year-old transgender youth, male to female, who faces considerable peer ostracism and family rejection of her gender identity. So she has very few friends. Her parents refuse to accept her gender identity and just want her to get a girlfriend, be normal. That's their attitude. It's just reject anything else. Keisha is a 15-year-old female. She's living with both parents. Both parents are professionals. They're working. She has an older brother. He's doing well. She enjoys school, is doing well, has a lot of friends, and has plans for college. And then Paul is a 9-year-old male who lives with his mother and 3 younger siblings. His mother has a job as a waitress at a local diner. They don't make a lot of money. She's a single parent. They receive federal benefits. So they're just kind of living on the edge. So if we look at risk factors here, I think you can pick out risk factors. For example, Hector being with cognitive delays. He's from a very rural area, so probably not really sophisticated, knowing a lot about trafficking. He's a migrant into another country, so he's very vulnerable because he doesn't know the culture. And poverty is a big thing for him, and running away from gang violence. Paul, his transgender identity is a big risk factor, and Keisha doesn't seem to have a lot of risk factors now, but there may be more underneath there, and her age is a big factor because she's so young. She's at that point in her life where she's taking a lot of risks and not able to think things through and have a lot of insight, so her age makes her easily manipulated. And then Paul is living a single parent, working hard, kind of on the edge of financial security. So if we ask ourselves, will any of these human trafficking risk factors increase during the COVID pandemic? And I think if we go back to our socioecological model, you can see that a lot of them highlighted in red are likely going to be exacerbated by the pandemic, therefore sort of increasing the risk of trafficking and exploitation. So if we look at the impact of COVID, mitigation efforts, social distancing has led to schools being closed all over the country, in most countries, non-essential businesses being closed, and many states with these shelter-in-place orders. So this leads to a lot of social isolation, unemployment, and financial stressors. Really interesting study just came out of the I can't remember, SUNY School of Public Health. Their survey in New York City was conducted on March 20 through 22nd, so that's just very recently. And they tried to do a very representative sample looking at job loss during the COVID pandemic. And so they asked people, have you or anyone in your household lost a job within the last 2 weeks? And a tremendous number of respondents. And they found that there were racial and ethnic differences, so that the highest risk group was the Latinx Hispanic community, where 40% of the respondents had said they or somebody in their home had lost a job within the last 2 weeks. And that is in stark contrast with the Caucasian and Asian respondents, which are the lowest, which are about 24%. African Americans were somewhere in between. There was also differences according to socioeconomic status, and not surprisingly, those households that were sort of on the edge to begin with, learning less than $50,000 a year, US dollars, were at highest risk of having their jobs taken away. 34% of their households reported somebody had lost their job. Really frightening. And then finally, another risk factor is larger families were at higher risk of sustaining job losses. So 42% of families with 2 or more children sustained a job loss within the family, relative to 27% of those families that were much smaller. So it looks like the people who are already very vulnerable are even more vulnerable to losing their jobs in this COVID pandemic. And it is by no means a uniform risk for unemployment and financial stressors. So you have to think about, what does this mean for Paul and his mother? His mother's on the edge already. Chances are that diner is going to shut down, so what's she going to do? So Paul is at very high risk here as well. You're probably aware of these statistics. They'll be out of date in a day or two, but as of early April, the U.S. unemployment rate reached 13%, which is, I think, the highest since 1946 or something. 6.5 million people lost their jobs. So this is a huge risk factor around the country and really globally. And there's a tremendous jump in unemployment rates and people applying for unemployment benefits in the prior 4 weeks. So a lot of desperate people out there. Other studies have shown that the people at highest risk are women and young people. And so, again, this puts much more pressure on families where there's a single parent who's the mother is at even higher risk of losing her job. Young people who are struggling, young parents who are struggling to keep their work jobs are at risk as well. And another sort of proxy to all this financial insecurity is looking at food insecurity, which is a very frightening thing. Nearly 35 million children in the United States receive at least one, if not two, free meals at school. So that makes up to 2/3 of their daily nutritional intake comes from free food. And that costs about up to $30 per week per child, which is a significant amount when you've lost your job and you're living on the edge. So when the schools close, suddenly there are no free meals. What are they going to do? So fortunately, the feds have responded and they've enacted some relief measures and allowed states to work with school programs that can function as if it were summertime, so they can continue giving meals as they would if it were during summer and there was no school. So they even allow home delivery and delivery of meals to non-congregate areas. The states and the school districts have become more creative with programming. In fact, South Carolina came up with a program where they would arrange to deliver up to 5 days of meals at one time for the family. So they didn't have to come every meal or every day to get their food. They could just get it for 5 days, which is a real asset. But the kind of the scary thing is this is all very new, right? So people are rolling this out, trying to, fly the plane as they're learning how to fly. And so these strategies are unproven. We don't know that everybody who gets the free school lunches is actually going to get them in these new creative ways of delivering meals. We don't know if there's going to be a wide enough reach, if there's going to be disparities in who gets these meals and who doesn't. Maybe the rural kids are left out. Maybe the urban kids are left out. And then there's also the concern about stigma associated with the free school lunches, and that maybe parents will hesitate to participate in these if they fear stigma. So there's a lot of insecurity about that as well. Another COVID consequence is the social distancing and sort of shutdowns and lockdowns have led to increases in family time. And this is, you've probably heard a lot about this, a real concern about intimate partner violence increasing in frequency and severity. And while there have been no sophisticated studies, of course, this is too early into the crisis to have real hard data, but there are a lot of countries and cities reporting jumps in hotline calls to domestic violence hotlines and police reports, et cetera. So in San Francisco, for example, the DA's office reported a 60% increase in domestic violence hotline calls in the first week of the lockdown, and the jump was somewhat less after that. And this has occurred in other countries as well. So we have to think about that. What occurs in these homes? Is Keisha's family situation that seems so idyllic, is that really as idyllic as we think it is? There may be a lot of family stress that leads to domestic violence, either prior to the COVID outbreak or some real tension builds up and the intimate partner violence starts now that people are locked down in their houses. So Keisha may be dealing with witnessing domestic violence. And the domestic violence can be very severe and can have specific COVID manifestations. For example, the abuser may try to manipulate the victim by withholding protective equipment, not letting them have masks, for example, or taking their insurance card, so if they get sick, they can't go get medical care. Or threatening them and giving them false information about the COVID crisis to scare them and manipulate them more. So there can be a lot of control and manipulation just around the COVID crisis. It's over and above whatever else violence and manipulation is going on. And this is sort of counterbalanced or unbalanced, if you will, by the the difficulties that intimate partner violence service agencies are having in reaching and serving their clients. Some of these shelters can't take in new people, or having a hard time taking new people because they don't want to bring in the possibility of infection, or they're shut down completely. So it's much harder for people who are experiencing this violence to get away from it in safe situations. The increased family time has also led to predictions, and again, we don't have hard data yet, but predictions of increases in child abuse and neglect. This is in some part related to the financial stressors, but also related to this sort of lockdown and the social isolation, where children who are witnessing domestic violence or living with a sex offender have much more time with them now. So that sex offender not only has time with them at bedtime, but now has all day with them because everybody's in the home. So there's more opportunity for offending against children. There's increased stress and violence. Children who may react to the whole COVID pandemic and be very anxious about it. It's very common for kids to be anxious. We're all anxious. And they may manifest that anxiety in ways that can be very irritating to the caregiver. Maybe they may be more hyperactive or more clinging or more aggressive with their siblings. And so that may translate into caregivers becoming even more angry and short-tempered and retaliating. And then to complicate matters, I think we're all aware that just about everywhere I've heard around the country and in different countries as well, there's been a plummet in mandated reporter calls to Child Protective Services. And you can see here on the right, New Hampshire data came out very recently. They published it. It was really good. They made it available to everybody. You can see on this graph, the black line is the Child Protective Service reports in 2020. And you can see towards the end, there's just this plummet in numbers of reports. And if you look a little further, they break down the mandatory reporting so that you can see in the left-hand column are the various types of mandated reporters. In the second column is the average number of reports made per week in 2019 by these mandated reporters. And you can see that, or rather it's the change, sorry, the second column is the comparison of this recent last week, sometime in March, compared to the average reports in 2019, weekly reports in 2019. You can see that relative to last year, the school and child care reporters have decreased by 55%. And law enforcement has gone down by 27%. Healthcare, 55%, mental health, 36%. So we're just not seeing these kids and not being able to report our concerns. And I think that is making everybody very, very anxious because we're all pretty sure that things are potentially riskier, yet we're not able to get these reports. And in many cases, responding to the reports, as I mentioned, is very, very difficult, challenging, given the social distancing requirements. And finally, children are spending more time online now. They're not in school, so they're online much more, and they may or may not be supervised. The parent working at home may be very engrossed in their own work, so they're not supervising their child online. And the person who is a sex offender, online sex offender, now has even more time to do that because he or she is not at work. So there is thought to be a very high likelihood of increased online sexual exploitation. And indeed, Europol has reported a sharp increase in the online activity of known online sex offenders. And so that's sort of being tracked. And they are seeing online sex offending increasing. And that entails things like online solicitation, where you're cultivating relationships typically with kids and getting them to do sexual acts either online or in person, producing, selling, buying child sexual abuse materials, what used to be called child pornography, and using the internet to recruit people for sex or labor trafficking. And this is not just children, but adults as well. Think about Pat and Keisha and Paul spending all that time on on the internet. Keisha's parents are both professionals. Maybe one is working at home, but they're, working hard on their careers. So they're working all the time and not paying attention to what Keisha's doing. So she's really unsupervised. And so is Paul and Pat. So there's a lot of risk there. So let's follow our 4 scenarios out a little bit and assume that they have been hit by the COVID crisis, just like you and I. So Hector, as we know, is a victim of labor trafficking. He gets to Houston, where the promised job involves tremendous exploitation, very long work hours, no breaks. The traffickers have taken his visa and his passport, so he can't leave. They make him sleep. When he's not working, he's sleeping with 10 other people in a room attached to the restaurant, and his conditions are horrible. So he's in a very crowded condition with 10 other people in the room, not social distancing, so there's infection risk there. When the business is closed down, the restaurant closes. So the traffickers say, you're out of here. We're going to keep your passport and your visa. So now he's illegal because he has no identification, and he has no job, and he's homeless because he was living at the restaurant. So everything, he's just out on the street now. So he is at tremendous risk for somebody coming along and offering him some work that may be extremely risky, may be illegal, is probably exploitative, and he's not in a good position to protect himself. Then we have Pat, our 14-year-old transgender youth. She is even more harassed by her parents since the lockdown, and she's getting more cyberbullying. All those kids at school who were bullying her in person are now cyberbullying her. So she finally runs away. Of course, she gets out there on the street, has no money, no resources, doesn't know what to do until a man approaches her and offers her $50 for a blowjob, or offers her to give some money if she'll sell drugs or move these drugs, or engage in shoplifting for him. So this is what she has to do to get by. She's being exploited in labor and sex. Remember Keisha, our all-American girl now at home, both parents working, preoccupied. She's online. And she's bored with her friends, so she gets, in chat rooms online and starts talking to people she doesn't know. She meets a 25-year-old who very readily says he's 25, and he clearly wants to build a relationship with her. And so he starts flirting with her and grooms her online, and she eventually, it doesn't take long, believes that he is romantically interested in her, and that she can have a good relationship with him. Now, she wants to respect the social distancing, so she resists his pleas with her to go meet him at a motel. She says, no, I can't do that, but he does convince her to send some sexual photos of herself, and she is not wise enough to see what that can mean. And once she does that, he begins sextorting her, blackmailing her, and say, you send me more photos or I put these online. He's actually selling them online anyway, and she doesn't know that. So she's being sexually exploited. And then finally, Paul, the 9-year-old who's living with his mother and 3 younger siblings. Mom does lose her job when the diner closes. Now they're facing eviction, they're facing hunger. She decides to allow the landlord to, quote, visit her son in exchange for rent. So he comes in and she says to her son, Paul, you go with him and spend some time with him. He molests the child and brings the child back to the apartment. She is also desperate. She takes a job at a shipping company. She's so desperate for work, and they exploit her. Long hours, below minimum wage salary, very exploitative conditions. So both mother and child are being exploited. Very depressing. What can we do? Well, there are some things that we as professionals can do. We can encourage adults and children to stay connected, both to their family and their friends, to people who can be supportive and who understand them, hopefully people who are providing positive relationships. And social support is so important. As we know, when we're not dealing with this COVID crisis, we're always telling our parents, the support and believing your child who's been sexually abused and supporting your child is the difference that's going to make a huge difference on the recovery of this child. So supporting, believing, providing Emotional support to people is so important, no matter what. So encouraging people to keep that up, using alternative creative ways of doing it online instead of in person. We can also educate parents and children about the risks of online exploitation and trafficking, be it internet safety for children, and safety steps that parents can take, as well as labor and sex trafficking recruitment techniques. Those things, those job offers that are too good to be true, are probably too good to be true, and offering support. We can talk to parents and children, and so that they can understand, the children and the parents need to be able to understand that the behavior they see in themselves and in other people in the home may be related to the anxiety around COVID, and that people have to sort of give each other a break on that and realize that extra, maybe Paul is being extra excitable and hyperactive because that's his way of dealing with the anxiety. And so if the mother can understand that, she may not get so irritated. We need to emphasize to Keisha and to Paul and to Pat that if they suspect themselves or a peer is being abused or exploited, they need to tell a trusted adult. And that goes against the givens of adolescence. You know, you never break that rule of secrecy. You never go to an adult and tell them something that your friend has told you. That's like, you know, breaking the code. But we have to encourage them to do that, encourage them to see that as a way of helping their friend. We've talked about online safety and safety features on iPhones, and encouraging parents and us too to talk to children about what they're doing online. Ask them what apps they're using, who they're talking with, what they're chatting about. Those kinds of things express interest so that the children are more likely to tell us about what they're doing. We can also emphasize healthy relationships, which is in a way helping to guard against online sexual grooming and sexual exploitation. And then talking about common labor and sex trafficking recruitment strategies, as I mentioned before. If you are working directly with children and families, I would encourage you to check in on high-risk families regularly, hopefully with video conferencing, and ask them, how are things going? How is COVID affecting you? How's your day-to-day, your life? How was yesterday? How's today? Has your mom lost her job? What did you eat for dinner last night? Those kinds of things can really sort of generally give you a sense of the risk involved. If things are really tense at home, you may be able to sense that and offer some resources. You might also be able to notice things while you're watching this child and talking to them online. You can watch the background and see if anything suspicious is noticeable that makes you concerned that maybe things are not going well there and you need to be concerned. If you do have an adult or a child who is very vulnerable, you can be very helpful by helping them develop a safety plan. For example, if you know that there's intimate partner violence in a home and you're talking to the mother, you can help her come up with a safety plan to protect her children and protect herself. Where can they go where they will be safe? If they're allowed outside, can they sit in the car for a while if mom's having an argument or something so that the children can be safe? What is the safety plan? If the abuser is hiding equipment and not letting them have masks, can the children hide their own equipment, their own hand sanitizer, for example? What can they do to stay safe? We can also offer resources. No matter where you are in the country or in the world, there are resources online which can be extremely helpful. If you have, for example, Pat, who's transgender, is really struggling with that right now. So it may mean all the difference in the world if you can provide Pat with information about the Trevor Project, which is a national hotline and support organization for LGBTQ youth and young adults. Hugely impactful, and it may prevent Pat from having to run away from home because she may be able to get the support she needs through the Trevor Project. Intimate partner violence support, we've talked a little bit about that. Giving hotlines and online tips to organizations, hyperlinks to organizations that have parenting resources can be really helpful for stressed parents. If you have concerns that someone is being trafficked, giving them the trafficking hotline, resource center hotline is really helpful. Teen hotline, suicide hotlines. You can even give people information about online AA meetings, which may be helpful for those with alcoholics in the home. These are just a few more resources that I've come up with today. Futures Without Violence, this hyperlink has a lot of good information on IPV and COVID, some good ideas about how to help plan for safety in the home. No to Violence has a lot of good information. One of the things talks about how you would make contact with people in the home if you think the abuser's in the home. How would you handle that? They have some tips on that. And then finally, In Violence Against Children has a lot of information, but also some specific tips on safety planning. If you have suspicions of abuse, exploitation, trafficking, and you suspect imminent danger, calling 911 is the thing to do, or whatever your emergency hotline is in your country. We need to follow mandatory reporting laws and whatever our organization's policy is. So if you're a teacher and you're doing home teaching with your school, you would still follow your school child protection policy and your mandatory reporting laws. But keep in mind, we need to be very careful to respect our client rights to privacy and confidentiality. If we are not mandated to do something, we need to get their permission. So we can't just, call intimate partner shelter on behalf of a woman if we don't have her permission. And these are some things we can do at the community level. We can advocate for school lunch programs that are effective and acceptable. Really go to bat in your state to make sure your schools are doing something that can protect those children who are hungry. We can advocate for moratoria on rent and eviction. Many states have that now, where people are forbidden, landlords cannot evict during this time. And really push for funds, emergency funds for access to safe housing, for IPV shelters, trafficking residential treatment center shelters for kids. And then once the COVID crisis is over, the social distancing is lifted, we still have a lot of problems. We need to provide job incentives for the most vulnerable. Remember, the Latinx, the people who are on the edge financially anyway, the people with larger families. Those are the ones who have priority to get jobs because they so desperately need it. And then finally, I think we can do whatever we can, whatever your job is, whatever you can do to increase awareness of your clients and of the public in general about labor rights and common exploitative situations. So that if you have Hector, who has no idea what American law is or his own labor work rights, as well, most Americans don't know either, if we can have that posted somewhere so people know there's places to go if you're being exploited, that can be very helpful as well. And finally, I'm going to make these slides available, but these are other resources more specific to trafficking. The International Center for Missing and Exploited Children has resources. American Professional Society on Abuse of Children, the National Human Trafficking Resource Center, and the Polaris Project. The Internet Watch Foundation is a great international foundation that looks at cybercrime and commercial sexual exploitation online. So just to conclude, there is good reason to expect a rise in labor and sex trafficking of children and adults, both during and after the COVID pandemic. We don't have, in most cases, we don't have hard data yet. So this is mostly theoretical with some early data supporting it. The consequences of the pandemic, mitigation efforts really exacerbate the risk for exploitation in very many ways, like we've discussed. And we as professionals can do something and need to do something to help play a role in primary and secondary prevention of exploitation, both labor and sex. This is my contact information. I'd like to open the floor up for discussion and people to weigh in with their thoughts and ideas, but also after this, if you have any questions or want some resources, please feel free to either call that number or email me, and I'm glad to schedule Zoom or reply and send you resources. So I'm going to stop sharing my screen now, and hopefully we can open up the floor.
So Jordan, while people will start to write their question, I will ask something with the mic because it will take me ages to write it. So, what do we need to do the day after the pandemic as social workers, as physicians, as counselors at schools, I mean, all the professionals. What do we need to do the day after the pandemic that will help us see those kids as soon as possible?
I think that hopefully your organizations are already planning on the post-COVID response. Hospitals, schools, they're already thinking, okay, what are we going to do when they lift the restrictions? And it may be a very graded response, but it'll be really important to have a plan in place with the people you work with so you have some protocol and you all are singing the same tune and being able to provide sort of as seamless as you can services back up. And it may be a ramped, staged approach that you're introducing certain services in phases. But as much transparency as you can have between yourselves and also with your clients, I think that will make it as smooth as possible. They need to know, your clients need to know what they can expect. They can't expect everything to go right back to normal the next day. It's going to take a bit. But people knowing that can relax more than if they get a sense that they don't know what's going on. Those are my 2 cents, but I'd be very glad and appreciate other feedback from others.
This is the opportunity to write questions in the chat if you'd like to, or open your mic and talk as well.
So I have a question. It doesn't have to do with what
Yes.
the last question was, but
Okay.
I work mostly with children, and I have found it difficult because all of my sessions are through iPad or Teams, and how to get the children separated from adults in order to really speak to them. And I have been creative by talking about, where's your favorite room? What's your favorite, like if you were playing hide and seek, where'd you hide? Or show me your favorite tree in the backyard. But what I've noticed about the parents who that we are working on behavioral plans with before all this happened, those parents are more what society would call helicopter parents in this situation, but I really think it's more of them just hovering over to make sure the children don't speak. So do you guys have any other creative ways or outlets to give the children the freedom to speak if they have something to say? Because I am struggling on getting them away from adults.
I'll just jump in, but I'd like to hear everybody else's. I think this is a unique problem. You know, for all my career, probably all of yours, we've had control over the situation. So if we have somebody in our clinic or something, you can say, well, I'd like to separate you, mom, go out to the waiting room. So you have control. Now we don't have that control. So the creativity is all we've got. And I think that if you get the sense you're talking to a child, maybe you see a bruise on their face or something, it's something that's really worrying, and the parent, you have the sense that the parent's right there. You can think about saying, suddenly I can't hear you very well. Can we switch to earplugs? And so that at least the parent can't hear you. Now, then you could also sort of say yes, no questions and say to them, just say yes or no or thumbs up or thumbs down, so that you're sort of communicating without a lot. Now, that is not great. We don't like to ask yes, no questions to kids, but that's one little technique. What are others that other people have? Oh, I think.
Sorry. I think the earbuds are a good idea because it does kind of offer where the parent can only hear one side, and they say they respect and understand that it's private, but that gives it another barrier for the child. So I think I haven't thought of that idea, and that's a really good idea.
And you might be able to say as well, Paul, let's fix a code word for this. Let's say choo-choo train is our code word for something's wrong or something, so that they can say that, or make it something that's a little easier, natural, so that you can say, if he says that, I know something's wrong. I got to be worried about something. What other ideas? Because I'm all ears. I think this is a really probably the most difficult thing.
Yeah.
Hello?
Yes.
Hello?
Yes.
What I do is I have kind of switched to where I start meeting with the parents, because when you're frustrated and you have a lot of anxiety as a parent, it's very hard to cover that up. And so, especially for my 6- and 7-year-old clients, which you can't really hold them for an hour anyway, I kind of include the parent, because if you're using something like Zoom, they can log in on another thing and be in a different room and still hear. My son has a writing class he does on Zoom, and I'm on my cell phone listening to the same class in a different room. So that really doesn't, you don't want to create that mistrust with parents.
Yeah.
So I have to where one of the family sessions I use for the parents. So I can do like a weekly check-in, how you doing? I mean,
I think
sometimes when we work with kids, we forget this is a family system. And at the end of the day, when you hang up that phone, they live with that person.
Yeah.
You don't want to create that mistrust in the home.
I think that's really good. And a lot of times that is where the problem is. So if you can address the mother's or the father's stress by talking to them and giving them resources, you're indirectly protecting the child. So I absolutely agree that talking to the parent is going to be a key thing.
Yeah, and I definitely think that we all do that. I'm just wanting to offer the child a little bit more of a free space, because I can talk to the parents all day and a lot of them can say everything's fine, and then you get a situation where like, well, mom got really mad at me yesterday and popped me. And I'm like, what does that mean? What does pop mean? So I think that I'm just trying to think of creative ways to give them that little bit of privacy if it's necessary. And that doesn't create an environment of distrust with the parent, because the first relationship you build is with the parent, or else you're not going to speak to their children.
Yeah.
Right. And another thing is, if you see, go ahead, sorry.
I would say there were a few more suggestions on the chat. One is able to say, can you tell the adult that you need to speak with the child alone, which is a possibility if things are not hidden a lot.
Absolutely.
And somebody else added that they would think that according to the age of the child, maybe working with a story, like giving homework, that they'll write a story.
Oh, that's a good idea.
I like that.
Yeah,
I like that.
too.
I like that very much. Yeah, that's good. That's a good one. Those are both very good.
Great suggestions, everybody. Thank you.
Hello?
The other thing that somebody said to me, and I thought was a really good point too, is they said, you know, if you're talking to this child every day, say for a week, and suddenly you can't get to them anymore, they shut down. The parent won't let you talk to them anymore for a few days, and then you can go back to seeing them. That would raise my concerns, because I would think, well, what are they sort of hiding? Has the child been beaten up? They're waiting for the bruises to go away? I don't know. So something to keep in the back of your mind. By no means a given. There could be a lot of reasons why, but that is something to keep in mind. I didn't mean to interrupt. Was somebody else, please?
Sharon has a question, right?
Well, I have a suggestion. One of the things I try to do, and even before the pandemic, is just build a rapport with the family. They show them how much you care. And during this time, you know, we're stressed, we're at home. If you can find funding to like send them a meal, have a meal delivered, I mean, it doesn't have to cost a lot of money, but it's worth the effort. You kind of build a rapport. You can let them know, you don't have to cook today. I have a surprise for you, drop it off. That's building rapport. So when you do call to talk to the child, they feel more comfortable with you because you care outside of the child. So as the lady before said, it's a family. And so if you can build a rapport with the whole family, like my child that I see, it's a foster child. They have 2 of biological children in the home. And I went to the dollar store, I was bringing something for the baby. I picked up 2 simple things at the dollar store and took it to the children. So like when I go there, I can't now, but when I do the FaceTime call, all the kids are trying to get into the screen to say hello. And so they feel comfortable. And again, I also let them know I need to see the baby, you know, and they put the baby and trying to grab the phone. So just building that rapport with the family. And even after COVID, we need to continue that so that you have that rapport. And the kids say so much. The other kids in the home, if they like you, they will tell everything that's going on.
Yeah, I think that depending on who you work for and what their policy is about giving gifts and stuff, I think that's really great. If you can do that, that's a real way, a solid way of building rapport, if that's available to you. Thank you for bringing that up.
Somebody added here that connecting families to resources, meals, and food banks is really important. And I kind of add that to the question about helping families and saying that you understand that they have needs as well.
Food insecurity is such a big issue. So I love that, food banks.
There are a few more suggestions. Ask them to show you their special toy in their room, or talk to your child and ask if he or she has been utilizing their safe place or something like that.
Good idea. These are great ideas. Thank you.
One of the things that I've done with my family since the pandemic, my biggest family, I have 3 clients in one family. We've been doing cooking once a week. And we do it on Zoom. So the family comes together. And before that, I text the oldest child and ask, what do you have in your cabinet? And then what are we going to make with that? And we've made
that's a great idea.
Different meals, cakes, everything. And it also gives you a chance while we're waiting. That's when the talking happens. Yeah. It's almost like being at the kitchen table.
That is an excellent
But I like
idea.
to cook, so it works for me. So.
Yeah, that is really
I really
good.
love that, because I really feel like it pushes the parent and child interaction, and you get to see how they interact with each other and how they problem solve. And so you can be a part of the middle of that to say, well, you know, maybe this is it. And so I think that's brilliant. So far we've just colored. Yeah. But they're all like 7 and younger. But I think I could get some cupcakes out of it.
Oh yeah, cupcakes.
I think that's a really good idea.
That is a really good idea. Even after this is over, I think doing cooking, because we all work in the 8 dimensions of wellness. And so food and budgeting and things like that, we can also put into our sessions. And so doing cooking with our clients in the home, I think could actually be something we could do.
And I think it gives you a really sort of good view of the state of the home. What's the food situation like? What's, you know, where people are working together, what's going on in that hour while you're cooking those cupcakes in the background, you know, it's great.
And it doesn't become intimidating when you ask, when you say we're going to make a meal, what's in your cabinet? And then you get an idea after week, and then you know what resources to suggest to them to pick up. If we're in Oklahoma City, there's so many resources right now. So it works.
That's good. That's great.
I know that there are some people from youth services here, and I'm thinking about the older kids. If anybody wants to let us know what's going on or ask a question. I think we've been talking mostly about smaller kids right now, and there's a lot of adolescents around as well.
Dr.
You also comfortable talk? Oh, yes, please go ahead.
Your opinion on, I've heard that Zoom is actually a platform that is often used for sexual exploitation of young children. And have you heard of there being any more awareness from companies, even Google, to be checking in more on things during this time where internet is being used even more to protect kids?
I don't know that, I don't know that companies are, Google and Facebook and things like that, I don't know what they're coming out and necessarily being active. They may be, I just don't know. I do know that the Zoom bombing is something to be concerned about, and then now they're advised to have passwords to the Zoom conferences so that people can't bomb in and drop child pornography in the middle of your session. So I am aware of that, and I think that in a lot of situations where there's telemental health and stuff, they're using alternate platforms if they can. That are super, super, super secure. But yeah, that's what I know so far. Does anyone else have anything to add?
We have another question here. What to do with older students if they leave the home or if they're kicked out, because many of the shelters are at capacity now?
Yeah, I think that's a really difficult thing, and it sort of depends on what your community is able to do. I think that it's important for the community to know what everybody is able to provide. So New Orleans is doing this great thing with their human trafficking task force. They set up a Google document, and all the service agencies have written on it's a dynamic document. They update it whenever they have changed their services. So if they say we're no longer accepting IPV people, or new residents. So that people are aware of that and will stop referring there. So you don't have to call 26 places and say no and get turned down. You know what's available and what isn't. Having said that, it's really community specific on how they're handling those very difficult situations where people are not accepting new kids or not wanting, foster parents not wanting to take children in, for example, because they're afraid they're going to bring the infection with them. So more and more, I think people are trying to get kids tested really quickly to say, well, they're negative, then so they're okay. Or one shelter managed, and they must have a lot of resources, they managed to, they have different buildings, and so they dedicated one of their shelters to kind of a quarantine for new people to come in, and as they're being tested and waiting for the results, they stay there. And if they're negative, then they can be integrated into the other parts of the program. So people are coming up with different ways, but I think it's a universal challenge.
We have another question about teens, actually from Youth Services in Tulsa, saying that she's been having a hard time working with teens because it's hard to find things or activities to do with their clients over the phone. And I think that maybe that goes to the fact that you're going to probably get less information that way in terms of kids being in trouble.
Yeah. So do other people have suggestions on how to engage children? So when you have a video conference, a Zoom conference, it's hard to engage. Is that the issue?
There's a few ideas here about playing hangman with their 6th graders when they're talking about emotions or feelings, and journaling some of the, or sharing things that they enjoy most. That's some ideas about working with adolescents, I think.
I like to do a lot of art, and so with my teens that like to be creative, we'll paint a picture together. So if they don't have art supplies, before this happened, I would supply them with them, but we'll both set up our canvas or our drawing boards, and we'll draw things. We'll play a game called Draw Me, and it shuffles out different ideas, and it says like, draw a creative potato, and then you take turns drawing that. And so while you're drawing, there's laughter, but you're also, when kids are doing things with their hands, they're more willing to just ramble, and they'll talk about things, and they'll sharing things that they're not normally going to share with you, especially if they like doing art. So I've been using
really good idea.
Apps. Yeah, I've been using a lot of apps to kind of guide some of my things.
I like that. I think that's really good. I think another thing you could do would be to, do you ever do this? Maybe your parents do this with you, where you start a story, you say part of a story, and then the other person takes the story and moves it further, and then you go back and you move it. So in a way, you're sort of helping them. You can get a lot of information about how they're feeling by how they imagine these stories to turn out. And that might open up the door for conversations and sort of build a rapport. I didn't mean to interrupt. Somebody else had an idea?
No, I think we're toward the end, and I do want to say that there are many suggestions on the chat about what to do with older kids. So if you all want to take a look, then that could be very helpful. And
whiteboard. Yeah.
Whiteboards, taking a walk while Zooming, share a screen with automated dice that everyone has a question, and so forth. Those are all ideas.
That's great.
Sharing things or
is
music.
There a way that you can save the comments and distribute them? This is wonderful.
We're recording the chat as well, yes.
Okay.
So, as well. Gal, are we about to talk about CEUs and?
Yeah, so thank you very much, Jordan.
Sure.
Thank you very, very, very much. And Christina, are you with us?
I'm here, Gal.
Okay.
Thank you, Dr. Greenbaum. That was really, really great information, and that discussion was amazing. That collaboration.
Yeah, it was great.
That was great.
Thank you, everybody. That was great. That was wonderful.
So just some quick housekeeping stuff. If you guys have attended these, you probably already know how it goes. In the beginning of the chat, in the beginning of the lecture, I told those of you who do not have your full name displayed on your Zoom, please put your first and last name in the Zoom chat. And for those of you who did not register or sign up for CEUs, if you would like them, please put your name and your email in the chat.
Okay.
Okay.
Yeah.
I just have to say, this is the best webinar ever. This conversation was so cool. I really have never done one where everybody's been so into it. So thank you.
You know what it means, Jordan. It means that I will ask you to give us another one.
Oh, it'd be great. I learned a lot.
Thank you. Thank you
video
very much.
I think these
Take
video
care,
chats are
everyone.
going to become our new norm, and we're going to just start
Yeah.
sharing so much on them.
That sounds great.
Stay
All right.
safe.
Take care, everybody. Yes, you too. Bye-bye.
Bye-bye.
Bye.